So Brianna chose this patient who is Meredith Gray.
Here I chose Meredith Gray. Now I
The
have
first
to go,
thing you do is...
Now I have to go over here to get my orders. Okay,
So she's in front of Freed right
Freed
now.
that my patient is Meredith Gray, so she will find Meredith Gray, which is here. She will hand me these 2 documents. These are the 2 documents that you will get. Okay, so then now I have my documents. So for me, I'm gonna go get my supplies. So consent form.
That's the blood consent form. And she's going to grab her supplies.
So alcohol swabs. Do you want to like visualize where it's at so that they can? So alcohol swabs. If you get a 3 ml here, or if they have the regular 10 ml saline. And then I will grab my primary tubing for Alaris and a secondary blood tubing. And then I will grab my 250 ml bag.
Okay.
And then I'm going back to the... So now I'm back to the room, set all my stuff down. And then I'm gonna go and... Hi, my name is Brianna and I'm gonna be your student nurse today. Can you please verify for me your name and can you spell it out for me?
Meredith Gray, MERIDETHGREY.
Okay, Meredith Gray, MERIDETHGREY. And your date of birth?
214.
Okay, date of birth 214. Perfect. Okay, so I have a order from the doctor that is for a blood transfusion. Did the doctor get a chance to talk to you about that?
Yes.
Okay, so I just have a consent form that I have to go through with you. Is that okay with you?
Yes.
Okay, so first question is, have you received a copy of the brochure, A Patient's Guide to Blood Transfusions?
Yes.
Okay, and have you received the information from your doctor concerning the risks and benefits of blood transfusion and any alternative therapies and risks and benefits?
Yes.
Okay, and you have had the opportunity to discuss this matter with your doctor, including pre-operative pre-donation?
Yes.
And then, are you subject to any special instructions listed below? You consent to such blood transfusion as your doctor may order in connection with the operation or procedure described in this consent form?
Yes.
Okay, perfect. So then I will have them sign, which I will sign for them. Do I just sign it? I'm just gonna do this. Meredith Gray, and then time 9:39. Oh, and the date is 3/31/25, and then I am the witness. So do I put nurse, registered nurse here, RN, and then my name. Okay, so consent form is complete. Okay, so now I just have a few more questions for you, if that's okay. Have you had a previous transfusion within the last 3 months?
No.
Okay, any previous pregnancy within the last 3 months?
No.
And have you had any previous transplants?
No.
Okay. So then I would do my checks for that. No, no, no. And then date of transfusion today, on consent.
I know, right? I was signing people's papers for there.
So then this is just the orders. So now that I'm done with that, I'm gonna go ahead and get my tubing set up. At first, I'm gonna check the line though. Here, get my alcohol swab because I'm going to flush the line. And this would be a new one, so I would take the air out. Okay. This would be clamped, so unclamp this, grab the hub for 10 to 15 seconds. Connect, check patency. Okay, Flushes good.
It's not infiltrating.
No infiltrate, no redness, no cold to touch. Okay, and I put a cap back on there, but we don't have any right now. Okay, so done with that. So now I'm going to set up my QE. Okay. I'd probably bring that table with me, but let's start with. So we'll open up our new packaging, but we're just going to use this for now. New packaging would have all that plastic stuff on it. You leave the doctor's order in the patient's room. You don't take that with you. What you'll take with you is your transfusion product slip and your consent form.
Okay.
Okay. So now we're going over to the lab, and then you will call or wait for your partner for this part. Okay, here I am. Hi, lab. So I need to pick up blood for Meredith Gray, Meredithgrey.
Okay, Meredithgrey.
Okay, and then date of birth 2/14.
Date of birth 2/14.
Okay, perfect. So here's the consent form and the transfusion product slip. Here's that for you.
Thank you.
And then I will take this. So now you have that, so you will be driving the checks.
All right, so then starting from the beginning, this is Meredith Gray, Meredithgrey.
Okay, Meredith Gray, Meredithgrey. Meredith Gray, Meredithgrey.
Date of birth is 2/14.
Date of birth 2/14. Date of birth 2/14.
MRN number is 084293.
MR number 084293. MR number 084293.
Okay, blood ID number is 400052.
Blood band number 400052. Blood ID 400052.
Component unit number is 0122098.
Unit number 0122098. Unit number 0122098.
Component number.
Oh, one more.
Oh, sorry.
Unit number 0122098.
So there's 3.
Yep.
And then component is RBCs.
Okay. Component RBC, red blood cells, and PRBCs.
Okay. Expiration date is today.
Expiration date today. Expiration date today.
There are no special considerations.
No special requirements. No special requirements.
Okay. And then blood attribute compatibility is B+.
Okay. Blood group BRH positive. BRH positive. Unit ABO/RHB positive, and patient's blood type is B positive.
Okay. And I believe that's
Yep.
everything.
Okay, so now we're good. So we will fill this out before I leave. And I will check my blood bag that it doesn't smell like anything.
There's no
There's
coagulation.
no coagulation. It's free flowing. There's no holes. It's brand new. It's beautiful and red.
The color looks appropriate.
Color
for
is
blood.
appropriate. Okay, and then here, so I'm the nurse requesting the blood, so I'll put my name here. And it is 9/9/51. And the date, what's the date?
331.
3/31/25. Transfusion consent form signed yes.
And then I'm going to be signing.
And then verified date of birth, medical record number, blood band number, unit number, and its appropriate patient and donor blood type, yes. Unit tag, yes. Blood unit label, yes. And then lab. Okay, so now that will stay with the lab. So both of these forms will stay with the lab, fully completed. Okay, so then that goes there. We'll still need that, yep. So now we were gonna come back to the room. Knock, knock, we're back. Knock, knock. Okay, we're back. My name is Brianna. I'm taking care of your nurse today. And I'm just gonna verify your name again. So you can do the blood bag at the wristband.
This is the second RN.
Yes.
So, I'm Meredith Gray. Push down so much.
And can you spell your name for me?
MERID.
And so you're gonna be here.
GREY.
And then you.
So Meredith Gray, MERIDETHGREY, and then Bloodband, MERIDETHGREY, MERIDETHGREY. So there's three.
And then MERIDETHGREY.
Okay. Date of birth is 2/14. Date of birth is 2/14. Date of birth is 2/14.
Date of birth 2/14.
Okay. Bloodband number is. Oh, I'm so sorry.
It's okay. Next is medical record number.
Okay. So that would be 084293 084293.
Medical record number 084293.
Okay. And then we have Bloodband, which is 400052. 40052.
Blood ID 400052. Now we will do our checks.
Okay.
So go ahead and continue on with the next.
Okay. Expiration date is today.
Okay, expiration date is today.
Unit number is 0122
Thanks, ma'am.
098.
And then on your bag.
And then 0122098.
Okay, unit number 0122098.
And then blood group is BRH positive, BRH positive.
Okay. And then patient blood type D positive and the unit ABO/RH B positive.
Okay, component red blood cells. Red blood cells.
Product PRBCs. Okay.
No special requirements.
Okay. And no special instructions. Okay, so now that that check is done, now we're gonna fill this part out. So, transfusion consent signed, yes. Transfusion information provided to the patient, yes. Identified patient, yes. Asked patient to state name and date of birth, yes. Verified the patient name and date of birth on cross-match check and patient's wristband, yes. Reviewed physician's orders, yes. So transfusionist, RN, and witness, so because I have this one, I'll sign as the witness, and you'll be the one transfusing. Or it doesn't matter, or other way. Do you want me to do that?
Yeah, I'll be the
Okay.
witness.
So I'll be the transfusion RN.
Are you paying attention to where you're picking up?
1056.
Are you setting up your steering?
1056. Okay.
And then I'll sign here. So Celine Hogan, 33125, 1056.
Okay, perfect. And then I would put my vitals in here. So let's say we're gonna
120 over 80.
We're gonna have to get a smaller one, and we'll say the pulse is 70. Temperature we'll say is 98.1. Respiratory we'll say 16.
Yes,
And we took those 15 minutes prior, so
So put the appropriate time.
we'll say
and
10:30 because it's within 30 minutes. And then that'll be that. Okay. So now I'm gonna go ahead and set up my blood. So now that we verified the blood, we're going to go ahead and set it up. So we're going to check our orders. And so for this order, transfuse 1 unit of blood over 3 hours. So that means we're gonna do 100 mLs per hour.
Because the volume of the blood bag is 300 milliliters.
Yes, the volume of the blood bag is 300 milliliters. So 100 milliliters per hour, and it's within the parameters of the 2 ml per hour.
2 ml per minute.
Per minute.
Which, if you do the math, is 120 milliliters per hour.
Here, no, just keep going. Okay, that, what Marina said. Okay, so now we're gonna get this set up. So,
I said you gotta learn English. The same word will be pronounced 8 different ways and mean 8 different things.
put this guy up.
Anyone trying to learn English gets confused. Ready?
I just don't want to get the, so go ahead and spike our bag. And we are open, and where's the, Am I locked? Okay, I'm locked. Good. Okay. So, blood. It's here. And then we're going to set up here. Lower this. Okay. So I'm gonna go ahead and put it in the.
So she's getting ready to run the blood down to the patient's saline lock, and that'll be a check where Freed will check.
So first I'm going to connect that, and then I would go around. I'm going to come around to the patient. It's okay. And then I'm going to, this would have a cap on it. So I'm going to scrub the hub again.
I'm gonna count how many.
It's clamped already. 10 to 15 seconds. Take the cap off, connect, leave that clamped.
3, 4.
Okay, so we are going to, yeah.
So you're not going to run it by hand, you're going to program
I did it by hand last time, huh?
whatever
Because it
you
didn't
want.
work.
That one's dealer's choice.
I'm gonna try it. And just see if it works this time. If not, I will do it by hand. If it wants to be today. Okay, so is it yes, a new patient? Okay, and then confirm, and then you will channel select basic infusion. So for this, we would just do the 999, 999, 999, 999, and then start. So it, of course it's not gonna.
It's occluded, so she's checking
Let's try again.
for clamps.
We want to leave that one closed.
Okay. Then it'll be occluded.
Okay. It's just gonna be harder to. Oh, there's one. There we go. Maybe. It's not doing it. No. See it?
Well, I mean, that's why I wouldn't. I'm
Okay.
not using the pump to run
So
it.
let's do it hand. It's hand.
So she's just going to prime it with
By hand.
hand regulation.
Yes.
So all the clamps are unclamped.
Just be the tubing. Oh wait, it's going.
It's
There it
gonna-
goes. Yep.
Okay, my hands away.
There it goes.
Under my knee. And then I'm gonna go all the way from 10 to 2. And then I'm gonna do what face. Yeah. Yes. But I guess if you do it with my hands. And then I'm gonna this one right. Don't need the alcohol.
She's waiting for the blood to run down.
To the patient, to here. So it's got to be pink all the way, and we are good. So then you want to clamp.
Clamp it when it's pink down
All
to
the
the
way.
hub.
So that would be our next check, I would call.
But not there, right? Above the...
I'm a little confused in that part.
I think it's just to here. Right here.
Are you sure? Because it's
When did you wait? Yeah.
Oh, would you do it all the way in?
I would do it.
Can't
Well,
say for sure.
We will get
Video.
clarification.
Still not.
We're going to just, there you go.
Yeah.
You're in.
Okay.
Okay. So now that that's done, we would call and ask. Or we'd tell the professor, okay, we need to check.
So she checks. It looks good. Continue.
So it's checked and locked.
Okay.
Well, that one's locked too, so okay.
Oh, okay.
So now we will set our pump.
All over the table.
We would set our pump. So for this one, it's
You gotta keep it
1 ml. I mean 100 mLs. Stop. per hour. So let's see if it works. Okay. And we are running it as a primary. Sorry. Okay, so we would actually have to go back. Let's restart it. Okay, so now we're going to start from the beginning. So we would go to patient, confirm, and then we channel select, basic infusion. And so for mine, it's going to be 100 mLs.
So this is the part that depends on your order.
Yes, depends on your order. And then also you're going to do this for the first 15 minutes. It will be slower, but because mine is within the parameters of the 2 mLs per minute, I'm okay. And then I will go ahead and have her check this before I start it.
She checked it, you can
It's
start.
good. So now I'm going to go ahead and start. Open my clamps. Okay. So now I am infusing my patient.
So you're infusing, it's running, it's been 15 minutes.
Now I'm going to get another set of vitals
Okay.
from Professor Freed. What are my vitals?
So scenario 1, the temp is now 100.2. All other vitals are good.
What are the other vitals? I need them. The same.
Yes, exactly.
All other
the
vitals
same.
are the same.
Mm-hmm.
So if I had this, I would then stop the infusion.
Why?
Because they're having a infusion reaction and the temperature is more than 2
Okay.
or more.
So you're going to
Above.
stop immediately.
Stop immediately. So we will
You could just verbalize all this.
pause, clamp, remove, and then we would go and we would get another, what did she say, 100? Or no, it would be another one of these.
Yeah, get all brand new
All brand new
tubing,
tubing.
flush the line,
Yes.
get another nurse,
Yes.
do all of your checks again.
all your checks again with the paperwork, your bag,
Then notify the doctor and notify the lab.
and then you would take your whole set of everything, tubing, back to the lab
Yes.
so that they can do their checks.
Okay. But in scenario number 2, all the vitals were great the second time. You do not suspect
So I
a
would
reaction.
just continue my infusion because mine is still within it's the order and it's still within the 2 mLs per minute.
So what is the minimum amount of vitals that you need during a blood transfusion?
3. You need to take the first one within the first 30 minutes before
Prior.
you start your infusion, 15 minutes after you start your infusion, and then one at the end of once your infusion is completed.
If she asks you about reactions and you blank, all of the possible reactions
Are here.
Okay.
And then there's more paperwork here we would have to.
Even what to do.
This is what to do right here.
If there was a reaction, it walks
Yes.
you through, oh God, I don't know what I would do. You would stop. You would do all of these. So it tells you.
Yes. And then how do we know that the infusion is done? The line would be clear, and then you would get a 100 ml bag of normal saline, plug it into the primary. So take this tubing off, plug it in there, and then finish running the blood. And then once you're done with that,
Is that it?
Yeah,